Good evening, everyone present here. At the outset, I would like to thank AIOS for giving me this opportunity to present this case. I would like to thank my my chief author, Dr. Gayatri ma'am, for guiding me throughout this paper. My topic is evaluating epithelial mapping dynamics with topical cyclosporin 0.05% in aqueous deficiency dry eye.
Slides moving? Yeah, it's moving.
Thank you, sir. Dry eye disease is a prevalent condition affecting millions of people, leading to ocular discomfort and damage. Traditional treatments include artificial tears and corticosteroids, but cyclosporin A offers promising immunomodulatory effects. So this is a prospective non-randomized study which included 30 patients. We observed these patients for a period of 3 months from July to September. Patients with moderate dry eye with Schirmer's test between 5 to 15 mm were included in the study, and patients with active ocular infection, recent ocular surgery and systemic disorders were excluded from this study, and also patients using contact lens. So baseline assessment include general ocular examination, basic slit lamp examination, along with corneal thickness and epithelial thickness using AIOS2025, Schirmer's test, OSSI stain index, tear breakup time, and OSDI index and OSDI questionnaire was followed. So outcomes, our primary outcomes mainly aimed at following up on the epithelial thickness, tear breakup time, Schirmer's test, and a secondary outcome include corneal thickness, OSSI stain index, and OSDI index. So statistical analysis were compared between the baseline and third month comparisons after using topical cyclosporin and topical cyclosporin. So the main results include mainly the main results include that females were more preponderant for dry eye, and these were the comparison of parameters between baseline and in the end of third month. We found that the corneal thickness significantly improved by the end of third month of using cyclosporin. Schirmer's test was improved. Epithelial thickness also was a significant improvement, and the tear breakup time also included in the study. So the main thing is the clinical impact, significant improvement in ocular surface parameters after 3 months, especially the epithelial thickness and the total thickness of the cornea, improved tear film stability, and also reduced ocular surface staining index score. So compared to the previous study, the epithelial mapping dynamics, there was increase in epithelial thickness and reduced staining, indicates epithelial healing and reduced surface irregularities, and restoration of epithelial integrity. Therefore, restoration of epithelial integrity is crucial. This was supported by previous study by Cornea et al. As far as the safety profile of the drug is concerned, it is well tolerated with no significant adverse effect, which is also consistent with the previous study. So it is favorable for patients with aqueous deficiency dry eyes. So in conclusion, topical cyclosporin 0.05% improves epithelial mapping dynamics, tear film stability, and symptomatic relief of the patient. However, further studies with larger population and longer follow-ups are warranted. These are my references. Thank you.
Were the patients prescribed only cyclosporin or lubricants as well? And how do you confirm whether it was not just a better lubrication?
Ma'am, we used only cyclosporin.
Only cyclosporin, so no topical tear substitutes at all?
No.
Okay. Thank you.